you scale up the organization, 2 people to 10 to 30 to 50 to 100 to 200. And that is the challenge once you get that far that you need to prepare for. Regulations are there for a reason. It's because we do dangerous things. And it's our responsibility as builders of products and companies to see to it that the ones we serve are safe. mySugr made that therapy more enjoyable and made the data useful in day-to-day lives. It was the first medical device app. It went through CE marking, FDA, launched in 70 countries, and then got acquired by Roche Diagnostics and grew to 200 in 1 year. And that was the biggest digital health exit in Europe. And just take the basic principles into how you work and express that in a way which guides the company in how it acts and develops things, and live up to the principles of the regulations. Actually, the regulatory environment enforces quality management. Every aspect of the company is held to act in a way which maintains quality. So you see at once, we need to fix this. And you have an established process for that change. By law, you have to focus on it and get it done. It's actually kind of a hack. If you can understand those rules and act accordingly, you have a massive opportunity. A friend of mine sold his company to Adidas for 250 million. They had 250 million users. They decided €1, perfect, 250 million exit. Bit. How I see VC changing now, you will see round 3 years ago, 9 million to achieve X. Now it's going to be 1 million to achieve 2X. Society is changing, and in some aspects is moving in the wrong direction. Is this aligned with the value that you represent?
Today, we brought you a specialist VC from Austria, which is Vienna, to discuss on the topics about funding the future of healthcare. So he's a serial entrepreneur turned to be a VC, serial entrepreneur to an angel investor, after that now becoming a VC officially. So we're thrilled to have Fredrik here today, and he will be also introducing himself soon, and we're going to dive into the discussion. So first off, let's have a look at the today agenda look like. Basically, we're going to be welcome Fredrik, some introductions, and we will dive into the discussion. So we're also going to be, prioritize your questions after the last quarter of the discussion. Okay, we thought before starting, a quick disclaimer. So this webinar is for information purpose. I have to say this. So only for, it's not for solicitation or endorsement for any investments. So again, investment is involved in risk, and please consult professional opinions shared by my own. We will be welcoming to Fredrik. Fredrik, thank you so much for joining today. Would you like to give a quick introduction about yourself before we start?
Hi, everyone. Thank you so much for joining us. And thanks for the intro, Edinj. Edinj and I got to know each other, both striving to become venture capitalists. That's how we got to know each other, through one of these FI programs. My name is Fredrik. I'm a Swede. I grew up in Stockholm and moved to Vienna around 20 years ago. I was diagnosed with a disease, a chronic condition called type 1 diabetes around 40 years ago. And type 1 diabetes, around 10 to 20 million, we're not sure, people on the world have it, and it changes your life quite a bit. It used to be that we died until 100 years ago. Diabetes is known since thousands of years, and it meant a slow, painful death. And then a guy in Canada invented insulin, or found this thing called insulin produced by a slimy organ in your tummy, and filtered it and gave the first injection to a boy who then lived to be old. And nowadays, I mean, I've done a few things, as you can read here on this slide. I've studied. I have 3 children. I've traveled to over 100 countries. I educate people, postdocs and MBAs. I have founded 5 companies. 3 of them are relevant. The other one were like consultancies or whatever. It doesn't matter. But 3 relevant companies, had exits and invested in 26 companies and such. And what has driven me through my career has been this thing, diabetes, and also entrepreneurship. You could say I was kind of the Edinj of Austria. When I moved here and studied, I ran into a few walls when it came to becoming an entrepreneur in medtech. And so I formed an organization which in the end had 50 employees and did hackathons all over Europe and organized one of the biggest tech conferences in Europe a couple of years. And then I founded another company focused on diabetes care, mySugr, a mobile app diabetes management system, which is by now used by 4 or 5 million people. And it makes the disease and therapy easier to work with, makes the data useful in day-to-day life. You see, diabetes is a bother. Not another B word there, but it's a bother. You have this, you're not capable, your body is no longer capable of working with sugar. And you eat quite a bit of sugar, don't you? So the cells can no longer accept it. And then we have to work, we have to, and if the cells can no longer work with sugar, well, the nourishment, they don't get fuel, do they, your cells? And thus they die and you die. It takes around 4 or 5 months. But now we can inject insulin, right? But it is a very dangerous drug. If you take a bit too much, your glucose goes too low and your brain stops working and you faint. If your glucose is high, then your body deteriorates and you die earlier. So you want to be stuck in the middle, right? That requires diligence because that's how your glucose moves all the time. And if you don't have insulin, it goes like that and you die. So mySugr made that therapy more enjoyable and made the data useful in day-to-day life. So you know how you react to foods and stuff. But it was the first medical device app. It went through CE marking, FDA, launched in 70 countries. We grew to 40 people and then got acquired by Roche Diagnostics and grew to 200, just about, in 1 year. That was a lot of fun. And that was the biggest digital health exit in Europe at that time. That was fun. Then I formed another company, hi.health, because I did health economics studies also. Like, how does society pay for, how can an insurance pay for access to medicine, medical devices, and therapies? And there I saw that if people have to pay $10 for access to heart medication, they don't. Instead, they don't take the meds. So we set up hi.health, a payment service and bank integrated with health insurances to get rid of the need to pay and the admin work for the patient. And that company now handles around $500 million in Germany every year in reimbursements and payments, and now launching payment cards together with big insurances. Yeah, and then I moved back to diabetes and am now working with diabetes companies in US and Europe. And what I've fallen in love with, this obnoxious piece of medtech and fintech, regulations and compliance. They enforce us to establish a method of working which drives safety and security. And if you do it well, it drives efficiency. It becomes the operating system of your company. And that's kind of a cheat. It enables you to see what's broken and to fix it. And I fell in love with that piece. Yeah, and now I'm an aspiring VC. See, I now work with over 30 companies in the medical space. I see so many things. Since I'm a researcher, serial entrepreneur, diabetic myself, I have a certain drive, right? And I've been in the trenches and I've been at the peak. So I try to help companies to get access to the community and knowledge and workflows they need, and to help them also with the compliance piece. So I put money in and then help them establish operating systems in the organizations. And it's so much fun, man. All right. That was a bit longer than maybe intended, but gives you some meat on the bones on to help us have a great conversation and to show you where my my views come from.
It's been great. Thank you so much, Fredrik. Thanks for joining us today. So, currently you're the GPO of 1921, which is a very interesting name. You briefly tap into this name, the meaning of the name, which is the invention of or discovery of the insulin, right?
Insulin, yeah.
Today we're gonna talk about with the Fredrik more, know him more today, because he's been experienced in the entrepreneurship and in the investment and recently the VC. So topics like scaling the companies in the regulated markets, entrepreneurship in general, especially entrepreneurship in the regulated markets and policies and impacting the startups and so on, and the key factors for successful exits, transition from entrepreneurship to VC, the new norms of venture capital and efficiency of venture capital, the power of specialization in VC, and many more. It's going to be a busy talk. I'm super excited. Okay, let's get started. Let's dive in. Okay, so I have some preset questions. I will always welcome it. So the first thing that I would like to know is especially the knowing more, because you have such an inspiring story as a professional, entrepreneur, and a person as well. Pretty influential you are in not just in industry, but other things as well, right? So with that being said, you specialize in diabetes, right? So have successfully built 5 companies in regular markets, and 2 of them exited, right? That's amazing. In such a one lifetime of your career, you're able to fit multiple success. I really admire. So the first question is now, I know you have a personal story behind all this, right? So you briefly introduced that one, but I would like to articulate that. How you decided to solve the diabetes because you have an issue, right? What was that transition process from the personal to the professional?
It started with kind of the antithesis. It started with non-compliance, a medical person would say. As in a few years, as I became an adult, I've been working as a software engineer since I was 16. So I've been busy, and also school and studies and stuff. But I worked full time pretty much since I was 16. And the diabetes became something I didn't want to bother with, even though it's a chronic decision, like 7 injections a day and blood glucose testing and going to the doctor and blah, 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 blah. It's a lot of work, like 2-3 hours of your brain is occupied with diabetes every day. So I just shut that down. And for 4 years, I didn't care. But then after a few years of that happens to many adolescents, for me as an adult, but I started getting back into it while I was studying medical computer science and game design and psychology. And I started hacking myself into different behaviors. So I started rewarding myself for testing my blood glucose once a day. That's how I then established a system for me that worked and found that this needs to be broader. So many people have this diabetes burnout. Why aren't people working on the psychology of diabetes? And that's how it started, that I then got engaged on a higher level than just personal. And entrepreneurship, I think. I read too many fancy books about heroes building big things or killing monsters, right? So what's the closest you can get today? Entrepreneur, I guess.
For sure. So I'm really curious, honestly, because, because you're extremely specialized in one topic, right? So it's not just in healthcare. You even branching down, focusing on the niche of the niches, So how your specialization influenced your current success so far?
Had this theory while I was studying, because I was studying 3 things at the same time, right? I didn't want to become a Model T, which is quite common nowadays, right? A shallow knowledge about many things and a deep expertise on one. And because where does innovation happen? Where does the creation of new things happen? It's when you have deep expertise that connects somehow. So psychology, medical computer science, game design, those fields led to mySugr. Capability to take a step back and think and sacrifice your own free time to build an organization without a salary for 5 years, that led to Pioneers, which then created more than 400 companies in Europe. Right? The intersection between things, that's where shit happens. So I'm not a specialist when it comes to operations. I'm a generalist. Health economics, data science, programming, software engineering, communication, financial planning, risk management, compliance. I mean, all those different things I've spent so much time on. I'm kind of a generalist, jack of all trades, master of some, but nonetheless the glue that makes things work, right? But in my nowadays, how I act, there I'm definitely a specialist. It's like where I really can create value is because of that broad understanding. In compliance, I can help design companies. And through my investments are all now focused on type 1 diabetes. Type 1 diabetes and the shit that kills us. So I won't die from diabetes, I'll die from heart conditions. If we build games to help educate people and raise awareness about type 1, hell yes, I'm in.
Yeah.
If we build algorithms to control insulin pumps and insulin infusion in intensive care unit, yeah, sure, can do that. If we build sensors that go into this blood vessel to measure glucose in blood instead of just under the skin that these sensors do nowadays, that's needed in intensive care units because your skin doesn't no longer really has the same nourishment that you need to measure, use a CGM on a body lying in an intensive care units, right? So now we need to measure in blood. Yeah, I'm in. Let's do it. If it's something related to diabetes, I can probably invest in health. That's how I became a specialist, so to speak.
I guess one of the common questions out there when it comes to the specialization among the startups, because I work with a ton of startups in my life. So
Yeah.
what I see is they sometimes, cannot figure out how they can scale from niche market. So from this, they sometimes, pre-assume that this is going to be very niche market, very small market, and that's so on. Sometimes investors also sometimes stuck with that point. So my question is about the scalable. The next question going to be, so we can go through the scalable by this way. So what were the like key strategies based on the companies that you scaled, your own companies or the companies invested in? What were the like, kind of key strategies, high level strategies, and decisions that help to scale these companies in such a niche market?
When it comes to the market, in type 1 diabetes, it's 10 to 20 million people have it, and it's around 15 to 20 billion a year, I think, in like the money spent on this disease or the therapy of the disease. Many undiagnosed and many still. I mean, I'm on the board of a hospital in Bangladesh. In Bangladesh, people do not get, there's no reporting on how many have type 1 diabetes because we die before we get treated. There are so many unmet needs. Now, when it comes to mySugr, it tapped into, there we tapped into two things that were happening, and that was digitalization and mobile apps, and then data, and then we got reimbursed, as in insurance started paying for the service. There, scaling from one business model to the other to be able to play with as many as possible and create the most value possible in healthcare generally comes down to, well, reimbursement, as in, can you find a way for society, be it through insurances or health plans, to pay for the service? Are you generating enough value? Are you reducing the risk of the population so enough that it matters? And can you tap a part of that value you create, translate it into money? Scaling outside of diabetes, we never did, but diabetes as a market is fairly big. The more like finding that big market, I think that's basic homework for every entrepreneur. Like Facebook for cats is probably going to work. There's a shitload of cats. Yeah, sure. But do they have money? Right?
Yeah.
That's just basic homework. But the more interesting piece of scaling is when you progress from one field to another and apply the learnings from there in another field. Sure. Theoretical, and I don't have much experience there. But what I find more fascinating about scaling is when you scale up the organization, 2 people to 10 to 30 to 50 to 100 to 200. That is part of the challenge once you get that far that you need to prepare for.
I see.
How many startups do you work with, Edinch, that have gone through that have gone from like 2 to 40? And there are like 3 brackets in there, like 2 to 10, big step, 20, big step, 40, big step. How do you see them handling this?
When it comes to the scale of employee count, or you mean like the market or the next
The employee count and head count, like how we develop our organizations.
most of our startups that graduate from our programs are basically very early stage, still early stage. Highest employee count so far in our portfolio is 25. Yeah, 25. So what happens is the hiring is pretty challenging. When they get investment, they tend to go for hiring an excessive amount for departmentalization and things like that. More they try to be more institutionalized. But I don't see that much that becoming an institution and then institutionally scaling up until they reach, if they can reach like around 50 to 100 employees. Because I also give some advisory to scale ups as well. So completely different characteristics. Early stage startups are, it's a founder stage, something that I call a founder stage, until like 50 employees. Founder-led growth, founder-led sales, they make the sales many things. Delegation starts when you start to have a couple of employees. Now, in my stage, I still have a full control in all the team because we only have 10. It's manageable, still like very small. But when it comes after 10, it started to become more delegation, management, and PMs. After 50, what I see is like start to become like an institution. Managers, chiefs start to emerge and like that. It's a complete. I believe it's completely different in a regulated markets like some of the startups that we have is also in healthcare, and to be honest, they all struggle. They struggle more than average. Other startups like who is in SaaS, deep tech, whatever. Healthcare is the most special ones. We always has this regulatory risk, market risk. We always need to assess. I think my next question going to be about that. So because we really need to talk about the elephant in the room, the regulations, and especially as someone like you who achieve a lot of things in such a regulated market, it's incredible, honestly. So I have a chance to talk about you on these. So I have
sure.
So from now, let's discuss on like how the government policies and regulations change the impact on startups, and how these regulations impact on healthcare and then fintech, because you have this uniqueness. I mean, amazing. So how these regulations evolve over time, and how do startups navigate these challenges of compliance?
It's one of my favorite topics, man. So you can join one of the classes I give on that. I lecture at a few universities on this, postdoc and MBA programs. So join me, man. I think it often comes down to a misunderstanding why people struggle with this. Regulations are there for a reason. It's because we do dangerous things. That's why we have regulation, to see to it that people don't die or get broke or whatever, go to jail. And it's our responsibility as builders of products and companies to see to it that our people, the ones we serve, are safe, be it monetarily or health-wise, right? Okay. And then the first time you read through ISO 13485 or 62366, ISO 62304, 5338, SOC 2, 27001, you just sit there going, oh my God, what did I get myself into? But then if you look behind how things are expressed, because it's written by lawyers based on input by engineers that have been around for too long. Laws and regs don't change swiftly. Agile software engineering came in the 80s. It took 25 years because before that was respected in our regulatory environments. Like there are methods described in these regulations that describe how to do software engineering well, where and how to mind risk, and how to control for those risks so that people do not run into the risks. Basic concepts, really. If you look behind the scene, but then when you read the regulation, it's like paragraph 15A, in the case of invalidation of specific criteria of the requirements based on post-market surveillance, it's just, of course you don't want to do this crap. And the people that get interested in it are often bureaucrats. But if you look behind the scenes, it's about taking responsibility for the safety of people. And then you read it with those goggles, and you see, all right, this is a description based on amazing amounts of experience and then expressed in a way which lawyers like to read. So get through that and just take the basic principles into how you work and express that in a way which guides the company in how it acts and develops things, and live up to the principles of the regulations. The footnotes, some auditors like footnotes. Those are details you can take care of as long as you build a dynamic way of working within the company. And actually, the regulatory environment enforces quality management. And that comes to, that quality comes in your employees, your HR, your finances, your every aspect of the company is held to act in a way which maintains quality and makes sure that you know what the hell is going on. So you see at once, oh, this is not working well. We need to fix this. And you have an established process for that change. By law, you have to focus on it and get it done. It's actually kind of a hack because it makes it simpler to scale from 10 to 15 to 200 because you have a system, you have an operating system of your organization which focuses on maintaining quality in all aspects of it. So if you build it in that way, you win.
Sounds like there are a lot of opportunities. Entrepreneurs, especially the ones that are like contrarian entrepreneurs. How about, you're in the European market, right? So you're specialized in the European market. So what are the opportunities do you see for not just for Europe-based entrepreneurs, but because our audience is very global, across the world. What are the like opportunities in these regulated markets, do you think, for entrepreneurs?
Like if you understand the regulation, like one of the biggest drivers of big change in society, and especially for startups, because it creates opportunity, is a change in legal and regulatory frameworks. Because suddenly there's an opening to do something in a new way. And that new way is what we strive for, isn't it, as entrepreneurs and as investors? We don't want to invest in another consultancy, right? But if a consultancy comes out which is able to replace 70% of the manpower by working more with artificial intelligence, which is regulated under the AI Act, and okay, now you have an opportunity. Is it a VC opportunity? Maybe not, but that's consultancy. It's often not a VC opportunity. But if you have now a change that we have a new framework for developing artificial intelligence models in Europe and deploying it as products in healthcare, finance, whatever it is. Great. Now we have the rule book. If you can understand those rules and act accordingly, you have a massive opportunity. And as long as you understand the principles behind them, you can act. That being said, in the US now, we have a bit of chaos where the current administration is saying that deregulate. Okay. Also a massive opportunity for startups, if you want to see it that way. So these societal changes are opportunities, right?
Yeah.
If you have a problem you want to address and suddenly the regulatory or legal framework changes, that's the opportunity for change which you can address to solve the problem. Can that change generate a method for you to work, which is different and makes you have like multiples better results than the closest competitor? Like that's what we strive to achieve, right?
Well, yeah, I see an opportunity in everything. All right. So you have exited two companies, Pioneers and mySugr.
And Pioneers exited the year after, but I was already out of the organization then, right? Because I built Pioneers and then I left to do mySugr. Of course, these are friends of mine, and I'm now one of my friends from Pioneers is now building a medtech company, and of course, I help them raise funding and help them get compliance right. So two of my organizations had exits. One of them I was very deeply involved in, the other not so. So don't put too much pressure on me there.
But no worries. It's still a lot of experience, a significant experience, honestly. Okay. I'd like to talk a little bit more about the exits because that's kind of like it could be a dream scenario for startup founders, but sometimes might not be, there are many clauses and things like that. High level, strategies, high altitude strategies, if you look at from high altitude, to successfully exit a company because you have experience a lot in that, So what factors led to these successful exits for you?
Relationships that even if you make a obscenely profitable business, unless you know the right people and click with them in the right way, it's going to be hard to have an exit, right? We were so intrinsically driven to solve diabetes or solve an aspect of diabetes, at least, of the therapy. Me and my co-founder, one of my co-founders and CEO at mySugr was also type 1, is also type 1. So we were very biased in how we communicated and acted, and it was easy to get a foot in the door, right? So first of all, the network you have, the friends you have, the shared values you have, the same goals you have. And then the change you drive for the business you exit to. Is it just to top up a revenue stream? Sure, can be. But in our case, we were the first digital health product that got into specific ways of reimbursement for the product that also shifted the business model of this partner we had, Roche Diagnostics. So it made it that they no longer had to haggle with insurances about price per test strip every year, because it was all bundled into our service. And that changed their business model and strategy. And that's in the end why they bought us. So solve a real big problem, like diminishing margins is what they were struggling with. And our service got rid of that problem for them.
Mm-hmm. So it's kind of like a strategic partnership thing. So
yeah,
what you're asking offers and they're asking offers needs to be aligned perfectly. And you see the best way of understanding is, that's my comment, I never had an exit before, but if you have an existing relationship, you maintain it. So you have a better chance to see it these days in your industry. That's why maybe specialization in the industry wise, it makes sense because the market getting smaller, so you can see the blind spots, needs, all the every players maybe.
Yeah,
I think I started getting.
But also a friend of mine, they built Kaleido, which got acquired by Canva, because their technology was interesting and could be applied all across Canva. And they were a very profitable business. And it was for Canva, it was a network thing again, technology which they had IP on, so patents on, which they could use. And it was applicable across the whole field. So strategic, yeah, makes sense. We can broaden our product portfolio. This is my interpretation of the exit, right? Ask Alex and the team, right? But in the end, for them, it was also, I guess, non-natural growth. So suddenly they spent like X million, say maybe 100 million, and they gained over 100 million users, right? Of course, it's a cheap acquisition of additional customers. That can also be the case. A friend of mine sold his company to Adidas for 250 million. And in the end, the conversation there was, all right, what's every user worth to you? Okay, there are 250 million users. They decided €1, perfect, 250 million exit. So depends if the company is looking into a strategic path, you change enough for the product, for the company, or it's an unnatural growth strategy they have. They have enough money, buy additional growth. Now we can report 100 million extra users. Boom, if that's important to you, right? So different ways of thinking about that. Depends on your market. And if you know the market well, you can assess what the problems are.
So acquisitions are kind of like a growth hack.
Yeah, growth hack for big boys, man. Growth hack for big boys and girls. Yeah.
So when the company gets so big, sometimes the growth in organic might not be that easy, right? So that makes sense. All right. So I think, I slowly try to articulate and dig inside more into your experiences with the questions that I prepare. All right, so let's go to like transitioning from an entrepreneur to a VC, right? But there is a one middle layer on that, which is you become an angel first. So invested a lot of companies. After that, you start the VC. This is how we get together, right? That you already mentioned that your angel investment experience, but I would like to a little bit articulate more. So how did you, shift from transitioning as an entrepreneur to that? So what was that, the first event, so to speak, the first trigger that happened to there? Walk us through like how it happened, all the angel messes.
I got rich.
That's it.
I mean, what do you do with money? There aren't enough Porsches. Just kidding. But yet, if you have money and you have enough drive and you've been hanging out with startups for the most of your career, it's kind of a natural progress, to be honest. It's if you don't start angel investing after you exited, I think you need to take a look in the mirror, man. Well, if it's a good exit, that is. Another friend of mine exited his company. He hardly made $1 million. That, angel investment is maybe off the books, right? Or not what you can do. If you hang around with startups enough and entrepreneurs and see the stories happening outside, and you have enough experience to bring value to a company, and you have the money, and you see a good deal where you think this is going to be if you can afford it, that and risking your family and such. I mean, angel investing is magical. It's so much fun. And if you do it the right way and create value for the company, you make friends for life, right? The first angel ticket I did was a week after our exit. Acquaintance, building a company, made sense. I wanted the product, tested it, kind of worked. Fine, let's go. And that company just exited 4 months ago. And the second one I did was in the diabetes space. And the third one I did, it's through the network and friends and the value you see being created. So transition, I know I did it in parallel. And for maybe a year, I worked exclusively on my investments 3 years ago or something, 2 years ago. And had so much fun. Like I could dig into these companies, bringing my knowledge in and just make them progress so much faster. Because I've been on both sides of the table, so to speak. Entrepreneur, exit, investor. I could bring some value to the table and make them speed up.
I see. So I think the right moment to ask my next question here, which is do you see the difference between funding a startup and investing in one?
There is so much work to be done. And such details and you have to love it, or you have to see it as worthy of your time. It's a load of work, and with a huge risk that it won't work and won't be an exit, and maybe you won't even make money, right? Maybe you can't even pay salary for yourself or your team. Who knows, right? There's so many details to be minded. Yeah. And so much work. Now, as a VC, you step out of that. As a VC, your job is, this took me a while to understand. Okay, let's start with investor. You put money in, and when you can, you guide. And if they need it, you come in and help out on some bit, right? But then you step out again, right? So if you have expertise to speed them up, great, if they ask for it. Otherwise, hold off and trust your founder. You put money in already, right? If you do not trust the founder, don't be an angel. If you have trust issues, don't invest, right? Okay. Then as a VC, your job is actually to make money for others. And this is something I'm learning now. Now I invest for others as a venture capitalist. So I have limited partners that have too much money for some reason, family offices, rich people, VP of this and that, whatever, right? Limited partners that invest into three things. So they trust me and like how I look at things and believe in my vision, my thesis. B, they want to have an impact in the field where you're investing, or they believe that I have a leg up there. Because C, that's what it comes down to, they make money. So I'm here as an investment manager. I invest in companies with a goal of making money for my investors. So I also am out there fundraising, right? Which is kind of, I didn't really care where the VC money came from as I was building stuff. Now I know more. So VCs are fundraising 80% of the time and investing 20% of the time. That's why they're busy sometimes, right? And don't get back to you, douchebags. It happens to me too. I'm sorry, guys. I have to get money into the fund, right? And when you invest as a VC, your mission is up to you. Is it just to put money in and then hold back and let the founder do their work and put more money in if you see it as something which can still become something great? And that's one side. The other one is to go in deeper, like you have been working at Edge, where you come in and help them go to market, right? Yeah. Or in my case, help with regulatory and go-to-market access. I bring in my whole type 1 diabetes network, clinical, medical, industry, everything. And we plug you into the community, right? That's how I see my value. But you're a step back or 10 steps back, right? You're not mucking about in spreadsheets and doing interviews or recruiting people or selling all the time, right? You're not writing Jira tickets and whatnot, right? But you're there to help guide on a higher level. And if you get a kick out of that, perfect.
Was the decision point? What made you to apply and get into the VC lab? And how was your experience so far?
Yeah, you meet these Turkish people in Japan. They're pretty, except for the hairdo and black t-shirt. Now it's been a lot of fun working with the VC Lab group. I think we were 600 people applying that got accepted to the program. Now we're 50 left,
Yeah,
something like that.
it was like I guess 3,000 people apply.
Yeah.
150 something accepted. No.
I know we're a few left, and it's fascinating to like. What I cherish is that many of us are going through the same journey at different speeds. Some of us have daytime jobs or nighttime jobs or night and daytime jobs, and this is a hobby. But then you drop out. The people that take it seriously stay in. Now, I'm a bit further along than many in the program because I've already found it. I've already done an investment or two with my fund. Yeah, I've incorporated. I've got my few LPs. Did my first commitment. But the learnings are magnificent, and the people you get to meet, those are people that have either gone through this before or have very good hairdos. And also the guidance you get, the raw guidance, which I really appreciate. There's too much curling going on in this field, but curling as in packaging of feedback in a very nice way. In VC Lab, it's raw and direct. Take it or leave it, but it's useful. And I really cherish that. Since then, I'm stuck with this too.
I think VC Lab for me was honestly quite life changing because I'm not part of VC Lab team, you know. I am joining as an attendee. Actually, it's a completely different undertake for me, complex because I'm running my company at the same time, and I'm trying to fund. So that was the reason. Actually, they didn't reject me in the beginning, but they said kindly like you should not apply because it's not gonna work. Because if you're running a company at the same time, it's just like climbing to Mount Fuji, but you have a giant rock on your shoulders. So climbing Mount Fuji is your company. You try to grow scale, and you try to carry a rock on your shoulders. Like this is what Adio was saying to me. So that's just it's been delayed. Like it's been 2 years after that. I joined, and finally I started to make the concept. You know, the company. You see how it's going to be work together. So that's why this GTM thing emerged over time. So I keep pitching and things like that. I initially configured things like a weekend fund, technically. Same fund. It's not a fund, guys. Okay. it's a community so far. But now I'm trying to be more serious to make finally able to launch. Still coming soon. It's how I also communicate with the world as well. But it's a good, both academic at the same time real life experiences. It forces you so much to go out there and then talk with the people. Amazing program in my case. I mean,
we're doing this, Adam. We're doing this in such an exciting time too, because like one of my investments now with 1921, this one engineer, he's doing the work of 15.
AI.
It's amazing. AI and how that is going to change startups and entrepreneurship and VC and the whole world. I mean, building VC funds in a time where so much is changing. And change is what investment is all about, right? That's where we need to put the money. So finding those things that change, and now the whole society is changing. Not just politically and regulatory, but also, do you think Amazon will keep the number of employees they have in the next 3 years? No. Middle management, software engineers, cut to a tenth because every engineer is 10 times as efficient, right? If they do the work in the right way. Compliance, big chunk of that can be automated. Put some robots on the floor and, 70% of Amazon's employees could potentially be fired. And what's going to happen once that happens?
Yeah.
Well, the smaller boys also need to follow suit. Otherwise, you have worse results. because we live in a short-term reporting, publicly traded place, right? We're going to have a massive unemployment. Yeah, okay, so that's societal thinking here. Sorry about that. But when we see startups with 2 people lifting the weight of 20, VC and investment and entrepreneurship is changing so much right now. It's just fascinating to be building something like this right now.
I see. So everything becoming more capital efficient, it's less effort, less money, less resources. We are able to achieve more stuff as entrepreneurs. And the backers of entrepreneurs, which is VCs, angels, and so on, is becoming more capital efficient. So what do you think? I guess, how this shift going to impact both investors and funders? I would like to a little bit more elaborate on that, your opinion.
Sure. What do you think, Edith? How do you see this happening in Japan?
I mean, Japan always comes a little bit late to these kind of trends, but this is not a trend or hype anymore. So this is something that I see like in person, in real life, in industry, in real life as well. So what happens is entrepreneurs able to build product easily, ship easily, and so on. But building something that people want and the distribution of it still remains challenge, honestly. So it's not that easy to build something that people really want. So even though like foundation models, and there are many foundation models that exist, they somehow find their customers, even though so hard to develop. But not all of them going to be surviving. Either they're going to merge, which is a consolidation in the market, or top 3 maybe going to be survived, something like this. So a kind of Cambrian explosion we are seeing, both in the startups or infrastructures and everything actually. So I think, in my opinion, it's good news. Very similar to the invention of the internet, and very similar cycles of Cambrian exploration times in the history of the internet and the startups. Very similar pattern I'm seeing. So it's going to be
like the introduction of the internet and some call it democratization. I think that's a stupid term. The open sourcing of knowledge, the publication of knowledge that you can become 30 years ago or 40 years ago was seen as a doctor, as an expert, as a PhD in a topic. Yeah, you can be that in a year now because you have access to the knowledge. And if you dedicate yourself, you're going to be at the level of a PhD 30 years ago, right? 40 years ago by now. Internet came, Anyway, there's such an access to knowledge nowadays. You can learn anything very fast. And now that's accelerated again, like 10x. Yeah, it's crazy. It's crazy. But how I see VC changing now.
Yeah.
Because startups are going to be so much more efficient.
Yeah.
A 2-man shop doing the work of 20. Jesus Christ. They will not need the same capital. The seed round 3 years ago, 9 million to achieve X. Now it's going to be like 1 million to achieve 2X, right? It's going to speed up and become a whole different game, right?
Your question, the valuation going to be the same or not? Are we going to pay less money for less percentage? Okay, but the valuation, right? So what do you think? So this is the only question on my mind, right? Obviously, we're going to be able to achieve a lot more with the less investment, or selling less equity, or are we going to be just cheaper? The company going to be cheaper or not? This is something that I'm discovering and researching a lot. I have some opinion, but what do you think?
In the end, when you assess the value, the enterprise value of a company, it comes down to the revenue or progress and milestones and how big the market is and what chunk you can address, right? That's what we base valuation on. Why should valuation then drop? Just because they need less money? Don't see that happening. Why would I accept that as a founder? No.
Yeah.
So instead, it's going to, if a startup now plays its cards right, it's going to be able to raise smaller amount or less equity at the same valuation, because the valuation is like, we don't just go, you don't need that much money, you're just worth 1 million. You just need 100K, but you're worth 20 million still based on your revenues and growth. So it's going to become more of a startups market, right? Because now we have companies that have 1.5 billion to invest in seed stage startups in this and that field, but the companies will just need 1 million, not 10 million. So you're going to have to invest in 1,500 companies. Good luck. You're going to need such a bloody manpower, man. It's going to be insane. So, okay, if that's the market, what changes? Pick and choose. Why should I get a stupid generalist just because they have 1.5 billion? They create no value for me except for more access to cash.
So, okay. And this is something that also I'm trying to figure out how we can really back as many startups as possible concept. But so currently, maybe not in the future. Anyways, it remains a question from me for sure. I think I have some opinions on that, but I also want to manage the time very well. I think, but you're right. As a kind of final comment, we're gonna be able to need to back as many startups as possible because many startups going to be produced there, and the money be able to be smaller check, maybe frequent check, or again, I'm just thinking out loud, maybe one check for the lifetime of the startup company. Sometimes, one trend that I'm seeing, I have to share. I think this is so exciting. Traditional VC, especially generalist ones, started to deploy to emerging managers. So this is where the opportunity with the VC lab comes. 80% of the VC lab grads are aiming to back to pre-seed seed level. So it was not a thing before. A pre-seed investment was like a 3F investment, right? Friends, family, and fools. But now the VCs are the one able to also provide the institution first money becoming this way. And then VC the perfect position for this one. A lot of VCs started to deploy for first time as solo. Even in someone that I recently get this news from Silicon, a 21 years old guy able to get, because his thesis is a perfect alliance to supporting people like him. He has. So we're going to maybe see highly specialized or specialized, not maybe vertical wise, maybe community wise and so on. Small solo VCs a lot, but they're going to maybe have a portfolio maybe 20, 30, or 40, maybe 50 if they figure out the systems, then deploying there across the regions and across the world. I think this is a pattern that I see.
That makes sense, because now that if this is the direction that the entrepreneurship ecosystem is moving, then specialist funds, tooting my own horn here because I'm a specialist fund, right? But that I see as a natural progression. And as a generalist, specialists are going to have the best friggin' returns because the value add of a specialist can speed up and accelerate the startup far better than a generalist, right? And as a generalist with 1.5 billion behind you, let's say, no, you rather start doing fund of fund investments, so invest in specialists. And then once those investments mature, then you put the big check in at the Series B. That kind of makes sense from a development standpoint. I believe, but what do I know? I'm just a medical computer scientist and compliance guy.
You're great, honestly. I'm learning a lot of things from you. Really appreciate it. And during the program, you also, peer support is one of the important what we see that, and also Founder Institute as well. You've been a great, amazing mentor for me, honestly. Learn a lot of things from you. Like obviously, we have different focus, but in some level, I think we're gonna someday we have actually a synergy that could be collaborated in the future. Which is a GTM focus. Maybe someone deals or companies who want to from this region. So
because I'm gonna be acting globally because I'm in a niche, even though it's it's like if I take a look at my thesis now and break it down into addressable market I have, it's right now around 650 billion because I address type 1 and the things that kill us: cardio, nephro, our kidneys, our livers, our hearts, neurological disorders that we get with diabetes. If a company addresses those, I'm in, or I can be in rather. And 1.2 trillion by the end of 30 or 35, give or take, is kind of looking at the current growth rate of these industries. So it's not small, but since it, for me, has to be connected to type 1 diabetes, I focus on that field. I'll be investing globally. So I'll be over in Japan investing you in a few years. Nah, it's I've last couple of weeks I've been in Berlin, Dubai. I'm going to Amsterdam, Sweden, Norway, Barcelona, San Diego, and San Francisco in the next 2 months to meet investors of mine, and B, peers, and C, startups. So right now, it's like I said, guys, being a VC is 80% fundraising, 20% investing. Nowadays, you kind of have to be outside of Europe because Europe is very scared.
So what are the things that you're looking for, especially from our audience? Do you have any, a call for collaboration? How our audience can support you?
Hugs. And if you are interested in the field of diabetes and chronic conditions, then get in touch. Like, I love getting to know new people, new viewpoints. First time we did business in Japan, I learned so much. The whole healthcare ecosystem, the whole healthcare system of Japan is different than totally like doctor-driven market instead of an insurance-driven market, or go to like B2B market as it is in Europe often. It's a totally different way for a healthcare system to work. And I love learning these things. So if you're into healthcare, if you're into specifically chronic conditions and very specifically type 1 diabetes, then please do get in touch. I love getting to know new people.
All right, it's good to know. Thank you so much for openness, and it's been great actually, Fredrik. As a conclusion, do you have some advice, one piece of advice, but for both entrepreneurs, but also for investors? Let's start with entrepreneurs.
Entrepreneurs, don't be in it just for the money, because then you could be selling drugs at the corner instead, right? It's be in it for the value you want to create in society. Otherwise, you're probably just a waste of space and time, even though you make money. So strive for something bigger than just a bloody wallet, right? For venture capitalists or budding entrepreneurs, think twice and get your family with you. Unless you have your family with you as you embark on in entrepreneurship, you're going to have trouble. So see to it that your family backs you, your girlfriend, boyfriend, children, wife, husband, father, mother, uncles, right? See to it that you have a network, because you're going to be busy. So see to it that you do that first. Strive for a higher value than just the money. And that is also going to help you pick your investors now that it's becoming a startups market. And to my fellow VCs and angels, investors, we always focus on value. Otherwise, you're in the wrong field. The value created through what we invest in, we get a chunk of that by supplying them with money. That's our job. But there's a higher value here too. Society is changing, and in some aspects is moving in the wrong direction. Is this aligned with the value that you represent and the stories you wish to tell your children, and what people should speak of about you after you have passed? Work for something higher than just the money. Because when you do, you'll also have a totally different alignment with those that create change in society, the entrepreneurs. It's not us. And if they follow a higher calling and higher values and can now pick and choose, be on their side. I think that's going to make us all have a better lives, right? And then operationally, things are going into specialization, use and abuse regulation, because it's good for you, keeps us safe. Medicine is changing so much right now, and things are going to be moving at a pace unheard of. But we say that every year, don't we? It's going to be a wild one. I guess that's it. Oh yeah, and join VC Lab. Otherwise, you're a stupid person.
It's been great, Fredrik. So really, I enjoyed this discussion a lot. It's been great. Thank you so much for doing that.